little
Yeah.
bit more.
I do
Yeah.
disagree with you. I think it's a big difference. Because that patient's going to have that rash again. And truthfully, that's really what bothered both of us in our conventional practices, that patients would get better for a short time and then have another problem or the same problem again. And that's what our health system has been criticized for over the past 10 or 15 years, and you've seen, all of us have seen tremendous change in the way we care for our patients.
Well, do you think it's too many pills? Is that what it is, too? Immediately, that's the first reaction, I think. Give someone a
Well,
pill.
Yes, that's
Yeah.
That's what we're trained
Definitely,
to do.
yeah.
That's what we were trained to do, and to be honest with you, once we started training in this holistic frame,
Right.
it was really angering. I mean, we got upset that we weren't trained this way in the first
Yeah.
place, and none of our colleagues were either.
Well, now what kind of patients do you treat? What type of patient?
Yeah, and just can I comment on something else?
Yeah.
So, just the last
Don't
question.
you two get in an argument?
The last question that you asked, as far as our training, right, in medical school, physicians are not trained this way. They're trained to only diagnose diseases. Once
Right.
they diagnose something, okay, then what pharmaceutical agent do we use to treat this? This is
True.
not the way patients get better. We're suppressing their symptoms. We're loading them up with a bunch of medications. I mean, so many people are over-medicated nowadays. They're on, 10, 20 or more pills.
It's true.
And, then they get nausea from one medication, so give them another medication to treat that. So definitely, everybody in America is over-medicated, and that's something that we are trying to fix one patient at a time, and it's working. It really is. We weren't trained for any sort of preventative medicine in medical school, things like nutrition, how to prevent these diseases. They don't train doctors that way. They don't. It's very unfortunate, but they don't. So we did that training on our own, and that's where we tend to focus with our patients. How can we prevent this? And if you do have a disease, how can we reverse this? Many diseases are reversible nowadays.
Well,
we know that.
there are a lot of physicians on radio out of New York, and I listen to them sometimes, and it is all about nutrition
Yes.
sometimes, and vitamins and that sort of thing. But I think traditionalists think they're quacky.
Yeah.
Is that true?
That's true.
Yeah.
And we were once traditionalists, and I was one
Yeah.
of the ones that was skipping
Right.
over that vitamin D study because I knew that
Right.
I was trained that was going to help my patient. And that's the part that's very frustrating, is that we were, and it's not, when I say we, I mean we as a group of physicians across the nation, were all taught that way, to discount non-pharmaceutical approaches to care. And if you look around the world, anyone that's traveled anywhere else outside of the United States, the doctors don't just reach for pharmaceuticals in the first place. They look at the patient and they try to look at the evidence. And everything that we do is an evidence-based practice, and we're board certified to know the evidence. And
But we are living longer
yes,
because of drugs. I hate to use that word that way, but it's true. I mean, there are
well,
people
it's
that.
been true.
Well, how about like people that have high blood pressure? A long time ago, they weren't really treated for it. They just had high blood pressure and that had a kind of a short life and, an occasional stroke or a heart
Oh.
attack. But now people are living longer.
Well, don't get
and-
me wrong.
Yeah.
There's no question that
Yeah.
we need pharmaceuticals.
Right.
Absolutely, no doubt about it. We're, as internal medicine doctors, that's
Yes,
supposed to be
correct.
our specialty. You
Yeah.
know? And absolutely, we use pharmaceuticals, but we don't reach for them first. Our
Right.
prescription pad is no longer in our hand, cocked and ready.
True.
It's in our back pocket, and we pull it out when it's absolutely needed, and there's no other way. Because the majority of most illnesses, especially in internal medicine, can be treated with diet, lifestyle, emotional, and spiritual approach.
You're right about that too. And most of the things that I've learned about the importance of vitamin D and magnesium and all the other stuff, it's really from these radio guys. It's true.
Yeah.
It's true. I mean, you don't go to your normal physician. I have a very good doctor, of course, but they don't do that really.
Right.
They don't have time to.
No.
How can they do that in a 10-minute visit or a 15-minute visit? The whole system is
Yeah.
set up
Yeah.
to drive a certain model of care, which is disease-based care.
Right.
And by the way, I do work at St. Mary. I'm one of the chief medical information officers.
You are.
I'm the chief medical information officer, which I also serve at Trinity Health. And so I'm very fortunate. I get to see these different perspectives as a provider, as an administrator, as a family member, because I have a huge family who pretty much all the time there's one person in the hospital. And so it's been really enlightening for me, and the integrative approach has been a wonderful part of my life, not let alone my career.
Well, how long does a integrative visit last?
So the visits, and it usually lasts an initial visit anywhere from an hour to an hour and a half. So I know that sounds like a long time, but
Sounds terrific.
It's wonderful. I mean, I think most doctors got into this field because they want to spend time with their patients.
Yeah.
But again, what Barbara was saying is, doctors now are forced to spend 10 to 15 minutes with a patient. How much can you learn about your patients in 10 to 15 minutes? You really can't. If someone's coming to you as a new patient with a problem, you will never figure out what's going on with them in 10 to 15 minutes. You'll write a pill for them and send them on their way. The patient's not going to get better.
Right.
So I spend an hour to an hour and a half with a patient. I get to know everything about the patient, figure out what's going on, and really help the patient. And it's wonderful. It is. It's absolutely wonderful.
Where are you located, by the way?
So we have several different offices, one in Yardley. We have a location in Newtown and Horsham.
All right. So how would we get in touch with you guys?
So we have a website. It's saluswellcare.com. And also we left some brochures on the table and
Oh, you
cards
did?
and
Yeah, that's
everything
good.
also. So,
Yeah.
right.
I think it's kind of interesting, you said, but now, how does integrative medicine work with our current health crisis?
Yeah, so this is a very long discussion, but I'll keep it brief.
Yeah.
We have now successfully managed the smoking and tobacco industry.
Right.
And because of that, we are seeing now in our mortality and our other outcomes huge benefits. And already in 5 or 10 years, we're seeing that improvement. We also have a big food industry. And the food industry really is the next tobacco industry.
Oh, that's true.
Yeah.
I agree with
the
that.
food that we're eating is causing the majority of the chronic illnesses that we have. And I'll just speak about myself. Most of you in the audience can see, I'm not obese. 5 or 6 years ago, 7 years ago, I was diagnosed with fatty liver disease. And I was like a toothpick. So how did that happen? How did I have fatty liver disease without even being obese? And it was because of my diet. And that really was very eye-opening for me, because fatty liver disease can kill you. It can cause cirrhosis if you don't manage it.
How do you know you have that?
Well, I just had routine blood work, and my liver enzymes were a little bit off, and after seeing, some more imaging and doing the right evaluation, I saw it with my own eyes, but as a physician and as someone that was fine, I wasn't debilitated in any way or feeling sick. I just said, forget it, no big deal. Meanwhile, I'm writing prescriptions and taking care of patients that have fatty liver disease, but as a physician, I didn't want to believe that I had it myself because I looked fine.
Yeah.
And it wasn't until the integrative training that, it really kind of clicked for me that, what was I doing? That was very irresponsible of me to not look after myself with this disease. And that's when I started realizing that you can't drink 4 sodas a day, the way I was before. You can't eat the fast food the way I was. You can't do all those things that I thought were fine because I looked fine, I felt fine. But since I've stopped, or I've not stopped, but I've really cut down a lot, I feel completely like a different person, even though I already felt well in the first place. And really, the healthcare crisis that we have now, and the reason why we're number 22 out of 24 on all kinds of lists, mortality in so many places,
Is that right?
is because of the food. So that's where an integrative approach can help our total healthcare crisis across the nation, and really focusing on food. I go as far as saying you don't even need to exercise. I know that's a big deal for a doctor to say that, but that also means that if you're eating the right food and having some activity, you really don't need to exercise, because you can't exercise off a Whopper. You have to exercise for hours and hours and hours, So if you don't eat the Whopper in the first place, you don't have to exercise.
Well, and not
Right.
only that, that's
They're
one.
going to come after you, the Burger Kings and the McDonald's of the world.
Please let them.
Yeah.
We're ready to take them on.
Yeah.
Food's definitely a thing, but what Barbara was also saying about you can't exercise off a Whopper, that's true. It's not only the calories that you're taking in, it's, what sort of food are you eating?
Yes, I agree
Something that
with
I
that.
recommend to all my patients is that they eat an organic diet. The kind of meat that these fast food places serve, it's not organic. They're loaded with hormones, pesticides, antibiotics. When you eat that, you're getting that in your system. These things, there's study after study showing that the hormones, the antibiotics, the pesticides, they're causing things like obesity, diabetes, heart disease, cancer. The list goes on and on. It's linked to every major chronic disease that people are suffering from in America. You cannot exercise that stuff off. So he's absolutely right about that.
Well, the diets, the high protein, low carb diets, for example, they always say, and some of these are doctor based, I think the Atkins, he was a doctor, wasn't
Right,
he?
yes,
Yeah,
yeah.
but they'll say you can eat all the fat you want. It's not the fat that's the problem, it's the starch,
Right.
the white
The
stuff.
sugar.
Sugar, definitely. Well, what about that then? So that's not good, because I've done those diets. I have very good luck with the no carb thing.
Right.
But then they tell you that you can eat all this bacon, and I don't do it, but I
Right.
mean, so what about that? So you cut out, so is fat bad also?
So
No.
therein lies the problem. You answered the question yourself,
Yeah.
is that you can't diet. It's
Yeah.
got to be part of your life.
Right, your lifestyle.
You can't go on a diet for a few months, and yes, you might lose some weight, and then just start eating the things that you ate before.
Exactly.
It's got to be a part of your life. And just look at me. There was nobody more unhealthy than me. I was the most unhealthy doctor ever.
Is that right?
Like I said, I looked
He
fine.
was unhealthy,
and
but not the most
Did you
unhealthy.
help him? Did you help him?
I did.
She
I
did.
bugged
She
him
did.
enough.
She really did save my life. I mean,
Yeah.
I would have never do the things that I'm doing now. I can't believe that I drink almond milk, for example, and it's because
Yeah,
of her.
that's good.
And I told you I have a huge family. My entire family, Punjabis, I'm Pakistani.
Yeah.
We like to eat. We're foodies, big
Yeah.
time. And
But you don't eat a lot of fat, do you?
Oh, we eat grease and sugar and
do.
fat and everything.
Is that right?
And I'll tell you, there are communities, and there's a community in Pennsylvania. I'm trying to remember the name, Risotto or I'm trying to remember the name. It's risotto or something
Yeah.
like that. Rosetto.
Rosetto,
And so
yeah.
this is a community of
other's
Italian
rice.
people. These Italian
Yeah.
people immigrated here for about 50 or 60 years
Yeah.
ago. Like this entire population, this entire town immigrated there. They have the highest level of tobacco use and smoking. They're all obese. They all have hypertension and diabetes. They all have really serious medical illnesses. However, their outcomes are outstanding. They have the lowest mortality. They have the lowest rates of heart attacks and everything. And the reason is that they also brought their culture. They all live in extended families. They all live the way they would in the Mediterranean place.
Yeah.
And so it just shows that there's more to treating these conditions than just pills.
People live longer, I think, when they're in a supportive community. and,
Absolutely, yeah.
Stuff like that.
They
And-
do.
And they also drink wine with a meal. It's part of the meal, the Italians, and that type of culture. So I think that's probably good too.
It's a stress.
What's the
reliever.
thing about the voodoo? He mentioned voodoo before.
Well, I joke and I say we practice evidence-based voodoo.
Stick little.
But we don't have the
needles in
dolls
people.
yet.
No,
I
you
have
have
to
the
get one of
dolls.
those,
I have
been
one of
looking for
those.
it. Yeah, but my colleagues, and that's another fun part about our role,
Yeah.
is that we've been in this, grew up, born and raised in this community. I went to school here and everything.
Mm-hmm.
And so I know everybody, because most of them were my family members' doctors, and now I work with them, and now I oversee some of them.
Mm-hmm.
So it's great to have these conversations because they know us. They know, forget about me, Rashida is an outstanding doctor. They know her. They know that she wouldn't just be practicing, voodoo medicine. Unless there was evidence. And so we have these great conversations, and it's been really fun to enlighten myself through this process and as well as our community,
Are there others like you in our community?
Absolutely.
Integrative medicine,
No
really?
question about it. We
Yeah.
work with a bunch of them.
Yeah.
And there's people in the audience, our friends from Oxygen Oasis are here. There's a nice community of people that we're trying to coalesce
Right.
and support each other because nobody can do it all. We have our piece, but the things that we prescribe, we don't do them ourselves. We prescribe them. So we need, people like Oxygen Oasis and other, yoga, Pilates, Reiki. All of these treatments that we previously would, be against or not even think about. We need those services. So no question, the community is growing big time.
Have you ever seen Dr. Thurman, and there's another doctor, and they're on TV, on PBS? They sound like they're so very food-oriented, like meat is a small portion of your plate, and a lot of veggies, mushrooms, and all of that other good stuff, see?
Whole
But I
foods.
don't understand why the regular doctors, the traditional doctor, wouldn't come around to this. I'll bet some of them are. Don't you think?
Oh, they
I
are.
think some of them are.
They are,
Yeah.
Right. And again, it has to do, it goes back to our training.
Yeah.
You know, in medical school, this is going to sound really funny, but we probably had, you know, nutrition class for about 4 to 5 hours, and that was it. I mean, that's literally the nutrition training that doctors receive, 4 to 5 hours total in medical school. So then, you know, when you start your practice, what are you trained to do? You're trained to give pills for absolutely everything. You know, so it's the doctors that are kind of coming around now and they're realizing, oh, you know what, there's other things that we can do to make our patients better. Very simple, cost effective, no side effects, nutrition. So start there, because that will help every chronic illness that we're dealing with, whether it's cancer, diabetes, hypertension, you know, autoimmune disorders. It can help everything.
But there are people that follow this line of thinking and say they have cancer, for example.
Right.
Then they think, well, chemo is going to make me sick and radiation is going to destroy me. So I'll just eat tree bark and nuts and seeds and everything. And that's not good either. So,
Right. Yeah, I mean,
Yeah.
you know, we encourage all our patients to be their own health advocate.
Yeah.
Whatever illness you're dealing with,
Right.
you have to research on your own. You know, as a doctor, we're supposed, you know, the word doctor actually means to teach. We're supposed to teach our patients. So when our patients come in, I don't say, well, you have to do this and you have to do that. No, like we're going to discuss what's right for that individual. Every patient's an individual. So what works for patient A is not going to necessarily work for patient B. So we look at everything, you know, we look at the mental aspects of their illness, their physical aspects, and we take everything into account, treat them as an individual, and come up with a plan. Right.
So all of your treatments are pretty much based on dietary recommendations.
That's what
They
we try to start.
incorporate,
We
yes,
try
we
to
always
start
start with diet,
Because
always.
diet is usually the cause.
And diet
most
doesn't
of
mean the Atkins diet, so let me just kind of.
Oh, yeah, I know
Yeah,
what you
it
mean,
means
yeah.
basically eating healthy, like.
That's not normal, really, the
No,
Atkins
it's-
diet. No, you can't live
Yeah.
on that.
Yeah.
Right, I mean,
Yeah.
that's not a diet that's sustainable, right?
Yeah.
So I don't like the diets that, you know, you do for 6 months and then you lose the weight and then you gain the weight back.
You
I mean,
do
what's the
immediately.
point?
You gain more.
And, right, because it has effects. You know, someone, you know, who tells
I
you to
know
eat,
that.
to eat bacon, you know, a pound of it every day, I mean, you're going to have effects from that.
So by
Yeah.
the way, did you know that the World Health Organization
Yeah.
earlier this year in February has classified bacon, sausage, all processed meats as class 1 carcinogens?
Right.
Is that right?
That's right.
Since we're
And-
sponsored by, you know, our beloved St. Mary Endoscopy Center, that's what they're looking for. They're looking for colon cancer. And so this was, you know, phenomenal news for us because we had no idea. And I love my hot dogs.
Yeah.
You know, and so these.
I don't like all that
I
stuff.
don't eat that stuff.
Yeah,
No, I
well,
like
you know,
it, but I don't think it's good for you.
It's not.
Yeah.
Well,
No.
no, it's they just declared it as
Yeah.
a level 1 carcinogen. So that means all processed meat. So that means hot dogs, sausage, deli meats. It's a level 1 carcinogen.
Same as cigarettes. Cigarettes are
Is
level
that-
1 carcinogen.
Well, I know all along I've heard that you're not really supposed to eat processed foods,
Right.
lunch meats and all that other
Right.
junk. But they said it carcinogen.
This is-
Yes,
Really?
World
it's
Health
on the website. Anyone can Google it and
On your
look.
website?
It's not on our website. It's on
on
the
the World Health Organization.
WHO.
Okay. Oh,
But
we're
if you
gonna look
Google
that
that,
up.
you'll get reference after reference for that.
This is
Well,
all
there you
evidence-based.
go.
Yeah,
But why wasn't this communicated broadly to the entire nation?
right.
And why? I mean, I wonder how many people in the audience knew about this. Could you raise your hand if you knew about this? A few people. Okay. But that's a few
Well,
out of.
we all kind of know that it's not the best thing for you. And I remember reading a long time ago about a high incidence of stomach cancer in certain mid-European countries because they eat a lot of kibasi, and
Right.
that's all processed meat.
Yeah, absolutely, it is.
Yeah. But they have a higher incidence of cancer in certain areas. What do you think about hot peppers?
Hot peppers.
Now, I think they have some
Depends.
benefits.
Well, anything that's
Yeah.
whole,
Yeah.
anything that's a natural food,
Yeah.
probably has a lot of benefits. I mean,
Yeah.
you know, it's
It
unlikely.
stands to reason, though. I always think it's bad for your stomach, but I read that it's very good for asthma even.
There is some benefits for hot peppers. I mean, if you're going to go and eat a pound of them,
Oh.
you might not feel well. But right, and you know, there are some people who
It's
are intolerant.
moderation.
Right, it's moderation. Some
Yeah.
people are
Yeah.
intolerant to,
Yeah.
for example, nightshade vegetables.
Yeah.
You know, but others can eat them. So
What are
that's
the
great.
nightshades again?
It's the eggplant, tomatoes, peppers.
Yeah.
You know, some people get symptoms from them, and then you know, you just avoid them.
Yeah.
But you know, the diet that we recommend, which is not a diet, is avoid the processed foods, eat organic as much as possible, and try to incorporate lots of whole food, plant-based. Everybody eats too much meat. Everybody,
Oh,
unless
sure.
they're vegetarian or vegan. But
Yeah.
you know, all of America eats too much meat. Meat's very inflammatory to your body. It
Mm-hmm.
causes a bunch of things that you don't want to happen inside your body. So that's some advice that we give to our patients also, is to cut down on their meat intake.
I also want to talk, after we come back, we're going to take a break right now and go back to WBCB. But I want to talk about vegetarianism.
Mm-hmm.
Okay, I mean, I think I know what you're going to say about that, but we're going to come back, and we're going to take a break right now, and we're going back to WBCB 1490 on your AM dial, and we will return again to the village at Flowers Mill after this.
Now back to Speak Your Piece, presented by the Endoscopy Center at St. Mary. Once again, here's your host, Pat Wadley.
Well, thank you very much, Merrill. And we're back with Speak Your Piece, sponsored by the Endoscopy Center at St. Mary. We're encouraging you to look inside. Now, we're broadcasting live from Village at Flowers Mill today, and we'll be discussing integrative health care. We have been discussing that, and volunteering for your health. Now, right now we have our good doctors back, and we're going to talk. I did leave you with a question. Rashida Ghauri and her husband, Babar Ghauri. Okay, I left you with the vegetarianism. Just briefly, tell us about the advantages of vegetarianism and the dangers of vegetarianism,
So
if there are any.
yeah, I mean, we can start with people who are strict vegans, and that would mean they don't get any food sources from animals, so not even like cheese, eggs, that sort of thing.
Right.
So strict vegans, they have to do things like take a B12 supplement, because that's one of the vitamins that you can only get from animal sources. So, you know, there has been cases of people who are not taking their B12, and then they end up with anemia and whatever sorts of things. But that's easily corrected with taking a supplement. As far as vegetarians, you know, that would include maybe they eat eggs and cheese, and then, you know, there are vegetarians who eat fish also. So,
Yeah, I was really talking about the vegans, I guess.
Yeah,
I
so the
didn't use
vegans,
right word,
right.
yeah.
So, I mean, as long as they vary their diet, they can get all the necessary amino acids, vitamins, and everything except for B12 from their diet.
Well, if meat is not that good for us, what kind of meat is? And how do you get your B vitamins?
So again, if you're a strict vegan, you have to take a B12
Well,
supplement.
what about regular folk like us? I don't eat a lot of meat.
I don't either.
I'm not a vegetarian, but
Right.
so you get it from chicken?
Yes, any
And
animal
fish.
sources, right.
Oh, okay.
Yes.
All right.
Yep.
Well, that's good.
Yeah.
All right. Now, we've got some questions here. What is your opinion on acupuncture as a pain management treatment?
You don't have to go with our opinion.
Abby, you want to get that?
Yeah, you don't have to go with our opinion, because there's
Yeah.
a ton of evidence for
Yeah.
acupuncture. Acupuncture is a commonly covered service now, so most insurance companies cover it.
Hand me them.
It just needs to be prescribed for the right types of condition. You know, so I'll just give you an example. This is really funny because one of my colleagues is an infectious disease doctor, and most hospitals, you know, there's all kinds of doctors at every hospital, but the infectious disease doctors, in my opinion, are the best doctors in the hospital. They're really smart. They know about every organ in the body, and they're taking care of really serious infections, and they're just really good doctors. And they tend to kind of shy away from an integrative model, right? So this infectious disease doctor went to India a month ago, and unfortunately she hurt her back before she went. So when she got to India, they went to an Ayurvedic doctor.
Oh.
which is not a conventional doctor. So that's a big deal for an infectious disease doctor to do that. The Ayurvedic doctor was an MD, PhD, so he had a conventional background, but he treated her completely as an Ayurvedic patient, so no pharmaceuticals, just acupuncture and some herbals and some, he changed her diet, and he guaranteed her on the first day that within 7 days she would be completely better, if not better than her usual, and she did. She was.
Is that right?
It was amazing. And
Was it the acupuncture or the nutrition?
it was the whole regimen.
package,
I mean, it
yeah.
wasn't just one thing.
Yeah.
So but they were all based in regular everyday things that cost nothing. Pennies compared to what we usually do, like MRIs and all kinds of things, and physical therapy and all the services that we usually do here. And it just shows that acupuncture definitely can have a place, especially in back pain.
They also use it a lot for PTSD.
Oh, is that right?
Yeah, there's a lot of research now using acupuncture for that, and meditation for PTSD.
Right.
That's a big thing.
Yeah, meditation's good. Now, I don't get this exactly, but what is boutique medicine? Because the question here is, are integrative doctors part of the boutique medicine? What is boutique medicine?
Yeah, boutique medicine
Sounds
or
fancy.
concierge medicine
Yeah.
are physicians who leave their traditional conventional practice to basically they stop taking insurance.
Yeah.
And there are lots of very good reasons why some
Right.
doctors do that. And I'll tell you, some of my very, very close friends who are great doctors, they have tons and tons of patients. And when they're looking at their traditional practice where they have to do all this paperwork and not get paid and all these kinds of things, and can have 200 or 300 patients and make tons of money and live a very nice lifestyle, it's very difficult when you have to choose between those two, because you want to help as many people as you can, but you also want to be there for your children and
Sure.
live your life.
Yeah.
And fortunately or unfortunately, fortunately for them, unfortunately for us, a lot of these people are leaving conventional practice and doing this type of care, and what does that mean for us that are going to need those doctors one day? They're not there. They're difficult for us to access because they don't accept our insurance. So in many ways, we are like a concierge practice because we also don't accept insurance, and the reason is not because the insurance won't pay us. They will. They just don't pay us enough.
Yeah.
We spend an hour and a half with a patient. They basically want us to see patients in 15 or 20 minutes.
Yeah.
So it just doesn't work in a business, and unfortunately that's the model that we're in right now. And we do, however, in our practice, we give a lot of care to indigent patients who can't pay. We've actually arranged for barters with some patients, which is a lot of fun, by the way. And we've given patients discounts.
old-fashioned.
So we will almost never turn away a patient. I mean, actually, it's never happened. We've never turned away a patient.
Well, before we go on a little bit more, we have to take another break right now. We're going to go back to WBCB and take a short break. You're listening to Speak Your Piece, and sponsored by the Endoscopy Center at St. Mary. Don't be afraid to look inside. It could save your life. And you can schedule an appointment at St. Mary's Endoscopy Center by calling 215-750-7700. And we will be right back.
Now, back to Speak Your Piece, presented by the Endoscopy Center at St. Mary. Once again, here's your host, Pat Wadley.
Okay, thank you very much, Merrill. And we are back, and we are at the Village of Flowers Mill. And we're going to be here just for a few more minutes, but we've got time for questions. And which is a question that we sum everything up here. Okay, also, now here it is. Can you eat organic food and still get illness? Is what you eat the only answer?
Yeah, I'm really glad you asked that, and one of our very kind audience members just came up and reminded us to talk about genetics.
Yeah.
Because genetics is absolutely a big part
Right.
of your health. So it turns out that it's not only genetics, and it's not only diet. It's multiple factors. It's multifactorial, right? So if you have genetics that predispose you to cancer or heart attack or stroke, and you eat a diet, or you are out in the sun, or you do things that activate those genes, then your risk for developing those conditions are much higher. And so this is a part of the service that we provide, is that we look at your genetics, and most doctors do that. I mean, we do very thorough history anyway, and try to identify what those risk factors are. And the difference, though, is prior to our integrative training, we didn't know. We didn't know which of these genes were activated by pesticides, or hormones or antibiotics, and now we have a better understanding, and nobody knows everything.
But you do think they're activated by something?
They are.
I mean, I know
Said
that
simply,
like
yes.
families that have cancer.
Absolutely.
Right.
yes.
The grandmother, the kid. The
Yeah,
this-
I mean, some genes
yeah,
are going to cause
yeah.
cancer, no question about it. Like,
Yeah.
we know what we know many of them. Not
Well,
all
but
of them.
even some of the cancers, like the BRCA gene,
Yeah, the BRCA.
50% of women who have that gene end up getting cancer. What about the other 50%? They don't. So we should be looking at those women and figuring out, why did they not get it? They didn't have a trigger. So you can have the gene for something, it doesn't mean it's going to get turned on. Something in your environment is going to turn it on, whether it's diet, whether it's, something in the water you're drinking, whether it's you're living next to nuclear waste, whatever it is. So it's something that's triggering that.
Okay, now, we could go on for another hour, but I just want to tell you, we are fini. And I want to thank our guests, Dr. Rashida Ghauri and Dr. Babar Ghauri of Salus, WellCare, and Abby Langstead, of course, down there, and Marlene Ford from the Bucks County Playhouse, and Tommy Green, former Major League pitcher, and our live audience host, that handsome devil over there. And join us next week. We'll be broadcasting live from the American Legion Post 440 in Newtown, Pennsylvania. Again, thanks to our sponsor, the Endoscopy Center at St. Mary. Take control of your health and look inside. And you may call 215-750-7700 for an appointment, or for more information, that's 215-750-7700. And we're going to leave you again, and we will see you next week. And I thank you so much for being here. It was
Thank you.
most interesting. And Dr. Goldstein will be here waiting, and he'll be talking to you from the audience. Thanks so much. Back to WBCB, and I'll see you tomorrow on the radio.